Good morning, everybody. Today we are going to discuss the anatomy of the pharynx. The pharynx is a muscular tube which is present in this region here. It lies behind the nasal cavity, the oral cavity, and the larynx. So here we find the hard palate, soft palate. This is the nasal septum. This is the base of the skull. These are the vertebrae: 1, 2, 3, 4, 5, 6 cervical vertebrae. This is the tongue in the oral cavity. Epiglottis. The epiglottis is one of the cartilages of the larynx. This is the larynx here. And the pharynx, which we are going to discuss today, is this region here. This tube which lies behind the nasal cavity, oral cavity, and larynx. It continues downwards as the esophagus. It is a common passage for air coming from the nasal cavity and for food coming from the oral cavity. The food usually goes downwards to the esophagus, while the air enters into the larynx through this inlet to the larynx, to the trachea. The pharynx extends from the base of the skull downwards till the lower border of cervical vertebra number 6. So the pharynx is a muscular tube behind the nasal cavity, mouth cavity, and larynx. Mouth cavity is the same as the oral cavity, it's the same. It extends from the base of the skull upwards to the level of the lower border of the 6. This is the pharynx here. This is the nasal cavity. This is the lateral nasal wall. So the septum is removed in this specimen. And you see here in the lateral wall 3 elevations. These are called conchae: superior, middle, and inferior nasal conchae. This is the hard palate, soft palate, uvula. This is the tongue, and this is the epiglottis. This is the larynx. This is the pharynx. It extends here from the base of the skull to the lower border of C6. The pharynx is divided into 3 parts. The first part is the upper part, is behind the nasal cavity. This is called nasopharynx. It extends from the base of the skull to the level of the uvula. The second part is the oropharynx, extending between the uvula and the epiglottis. The third part is behind the larynx. It extends from the epiglottis to the lower end of the cervical 6 vertebra. This is called laryngeal pharynx. So we have 3 divisions of the pharynx: nasopharynx, oropharynx, and laryngeal pharynx. This is another drawing for the pharynx, and as you see here, the pharynx extends, giving the esophagus. This is the nasal septum, hard palate, soft palate, tongue, epiglottis, larynx, trachea. We are going to concentrate on the upper part of the pharynx now, which is called the nasopharynx. Here is the nasopharynx. This part here is the nasopharynx. It extends from the base of the skull to the level of the uvula. What are the structures that we can see inside the pharynx? In the nasopharynx, the first thing we can see here is this opening. This is the opening of the Eustachian tube. What is the Eustachian tube? The Eustachian tube is a tube opening here in the pharynx, and in the other end it opens into the middle ear, which is the tympanic cavity. So here we can see the pharyngeal opening of the Eustachian tube. The Eustachian tube has two other names: pharyngotympanic tube and auditory tube. The second thing we can see here in this region of the nasopharynx, this elevation here. So the mucous membrane is elevated here on the tube because there is lymphoid collection under the mucous membrane. It is called the tubal elevation. So the tubal elevation is elevated mucous membrane over the pharyngeal opening of the Eustachian tube. It is elevated because there is a tonsil here. This is called the tubal tonsil. Extending from the tubal elevation downwards, you can find here a fold from the mucous membrane going towards the pharynx downwards. This fold of mucous membrane is called the salpingopharyngeal fold. Salpinx is a tube. So salpingopharyngeal fold is a fold between the Eustachian tube and the wall of the pharynx. This fold of mucous membrane contains a muscle with the same name, salpingopharyngeus muscle. Behind this tubal elevation, you can see here depression. This depression here is called the pharyngeal recess. Pharyngeal recess. Posterior to the recess, there is a lymphoid collection here. It's a tonsil. It's called the pharyngeal tonsil between the mucous membrane and the base of the skull. The pharyngeal tonsil is a collection of lymphoid tissue. It is sometimes swollen and becomes very big, and descends downwards, obstructing the airway passages. This is called adenoids. So when the pharyngeal tonsil becomes big and swollen, it is called adenoids. This occurs usually in young age. So these are the structures found in the nasopharynx: the Eustachian tube opening, the tubal elevation, the salpingopharyngeal fold, pharyngeal recess, and pharyngeal tonsil. What about the Eustachian tube? The Eustachian tube is a tube connecting two cavities together. It connects the nasopharynx with the tympanic cavity, which is the middle ear cavity. This is an explanation for the Eustachian tube. This green part here, this is the region of the nasopharynx. This is the ear. This is the middle ear, or the tympanic cavity. So the tube connects the pharynx with the middle ear cavity or the tympanic cavity. It has a function. It controls the pressure of air inside the middle ear cavity. What are the structures present in the oropharynx? This is the region of the oropharynx between the level of the soft palate and the epiglottis. You are going to find an oval corrugated elevation here just below the soft palate. This is a tonsil, which is called palatine tonsil, because it lies under the soft palate. In front of the palatine tonsil, there is a fold of mucous membrane extending from the soft palate to the tongue. This is called the palatoglossal fold. There is another mucous membrane extending from the soft palate to the pharynx. This is called the palatopharyngeal fold. It lies posterior to the palatine tonsil. So this is very important. We have two folds surrounding the palatine tonsil, one in front and one at the back. These folds, sometimes we call them arches. So we have a palatoglossal arch in front of the palatine tonsil and a palatopharyngeal arch behind the palatine tonsil. Why we call them an arch? Because if you open the mouth and look from the opening of the mouth, you are going to see them as an arch, curving downwards and laterally. What are the structures seen in the laryngopharynx? The laryngopharynx is this part here. This is the posterior view of the nasal cavity, oral cavity, and larynx. Look at this cut edge here. This is the cut medial edge of the pharynx. It is cut in the middle and reflected laterally. So here you can see the nasal cavity, nasal septum, and these are the conchae. This is the soft palate and the uvula. This is the back of the mouth or the posterior third of the tongue. Epiglottis. This is the larynx. This is the inlet of the larynx, in which the air goes down inside the larynx to the trachea. If you look here at the sides here, you are going to find a depression. This is called the pyriform fossa. So in the laryngopharynx there is a fossa which is called pyriform fossa. Sometimes a foreign body can lodge in this region here, and it's very difficult to remove it. Sometimes you need anesthesia to be removed by a certain technique. This is the epiglottis, and there is a fold here for the inlet of the larynx. This is called the aryepiglottic fold. If you go downwards, you can feel hard consistency of the cricoid cartilage. Here you can feel hard part of the lamina of the thyroid cartilage. So if I tell you what are the relations or the boundaries of the pyriform fossa, it is bounded medially by this fold, the aryepiglottic fold, and bounded laterally by the lamina of the thyroid cartilage. These are the boundaries of the pyriform fossa. Medially, aryepiglottic fold, laterally the lamina of the thyroid cartilage. What are the muscles forming the pharynx? Actually, we have 6 muscles. We divide them. The first group, 3 muscles, they are circular muscles. The last 3 are longitudinal muscles. Circular muscles means that they pass circularly around the pharynx. They surround the pharynx. So when they contract, they propel the food downwards. These 3 constrictors, they are called superior, middle, inferior. We are going to study these 3 muscles at first. Here, if you look at the pharynx, this is the pharynx here. We are looking from the right side. This is the mandible, maxilla, medial tragoid plate, hyoid bone, thyroid cartilage, cricoid cartilage, trachea. Look here, this greenish layer, it's a membrane between the thyroid and the hyoid bone. This is called the thyrohyoid membrane. If you look up here, this is the base of the skull, and this is the styloid process. Here we have 3 muscles. 1, 2, 3 muscles. These are called the constrictors. Superior constrictor, middle constrictor, inferior constrictor. They are circular muscles. They begin from the front and they pass surrounding the pharynx to the back. And you can see that they overlap each other. The middle constrictor overlaps the superior, and the inferior overlaps the lower part of the middle constrictor. What is the origin of these muscles? The superior actually is at the level of the mandible, the middle at the level of the hyoid bone, the inferior is at the level of the thyroid cartilage. So this will help you to remember the origin of each muscle. We are going to speak now in more details about the attachment of the superior constrictor of the pharynx. This is the superior constrictor here. You know, the medial tragoid plate has a process downwards. This is called trigoid hamulus. And you remember that there is a line inside the mandible. This is called mylohyoid line. So this muscle is attached to the trigoid hamulus and the posterior part of the mylohyoid line. And this green, it's not green actually, it's fibrous tissue extending from the trigoid to the mandible. It is called pterygomandibular raphe. So this muscle has three places to originate from. The first one is the trigoid hamulus. The second one is the pterygomandibular raphe. The third one inside the mandible is the posterior part of the mylohyoid line. This muscle passes backwards, fanning backwards, to be inserted into, this is the superior constrictor. It passes backwards to be inserted into a tubercle coming down from the skull. This is called pharyngeal tubercle, and into this white fibrous tissue. This is called pharyngeal raphe. So you are going to see that all the three constrictors, they fan posteriorly and upwards to be attached to these two structures, pharyngeal tubercle and pharyngeal raphe. What about the middle constrictor? The middle constrictor, which is the brownish muscle here, is also attached to three structures. Look here, this is the hyoid bone, this is the lesser horn, greater horn, and you can see this ligament coming from the styloid to the hyoid. This is called the stylohyoid ligament. So it's attached to the stylohyoid ligament, lesser horn, greater horn. Also, three places to be attached anteriorly. What about the insertion? The same insertion. It passes backwards, fanning upwards, to be attached to the pharyngeal tubercle and pharyngeal raphe. The third muscle, inferior constrictor. This is the thyroid cartilage, this is cricoid cartilage, and in between the two there is a fibrous tissue arch here. So the origin, thyroid cartilage, cricoid cartilage, and fibrous arch, and this line here in the thyroid cartilage is called the oblique line of the thyroid cartilage. So also here we have three places to be attached to. What about the insertion? The same, pharyngeal tubercle and pharyngeal raphe. So remember the origin of each one of the constrictors from three places. We are going to revise again. The superior constrictor originates from the trigoid hamulus, pterygomandibular raphe, posterior part of the mylohyoid line. The middle constrictor originates from the lower part of the stylohyoid ligament, lesser horn, greater horn of hyoid bone. The inferior constrictor originates from the oblique line of the thyroid cartilage, fibrous arch between the two, and the cricoid cartilage. The insertion of all constrictors in two places, pharyngeal tubercle and pharyngeal raphe. All of these muscles also they have the same action and the same nerve supply. The action of these muscles: when they contract, they constrict the pharynx, propelling the food downwards. So when the superior constricts, it propels it down, and this one propels it down, and so forwards. The food is propelled downwards. This is the action. The nerve supply is the cranial part of accessory. The accessory nerve is cranial number 11. So the insertion of the three constrictors, the pharyngeal tubercle and pharyngeal raphe. Remember that the three constrictors are inserted into pharyngeal tubercle and pharyngeal raphe. They have the same nerve supply, cranial part of accessory. They have the same action by propelling the food downwards. So they are only different in their origin. What about the other three muscles? We have studied these constrictors here, but we have also longitudinal muscles coming longitudinally from above downwards, and they are inserted, all of them, in the wall of the pharynx. The longitudinal muscles, one of them arises from the palate. It is called palatopharyngeus. Number 5 from the Eustachian tube, salpingopharyngeus. Number 6 from the styloid process, stylopharyngeus. From which part of the palate? We have taken a lecture about the palate before, and most of the muscles are attached to the palatine crest and palatine aponeurosis. This is the origin of this muscle. This diagram here shows the three longitudinal muscles. Salpingopharyngeus is this one here, coming from this Eustachian tube going downwards. The other one from the palate, palatopharyngeus. The third one from the styloid process, stylopharyngeus. The three muscles, they come down to be inserted into the wall of the pharynx and the posterior border of the thyroid cartilage. So the three longitudinal muscles, they differ in their origin, but they have the same insertion. The insertion is in the wall of the pharynx and the posterior border of the thyroid cartilage. When I ask you, what is the origin of the palatopharyngeus? The palatopharyngeus from the palate, from the palatine crest and palatine aponeurosis. Where is the insertion of the palatopharyngeus? The insertion is in the wall of the pharynx and the posterior border of the thyroid cartilage. So these are the longitudinal muscles. They have the same insertion. They are inserted into two parts: wall of the pharynx, posterior border of the thyroid cartilage. They have the same action. When they contract, they pull the wall of the pharynx and the thyroid cartilage upwards. In order to know the action of any muscle, you pull the insertion towards the origin. All the muscles of the pharynx are supplied by the cranial part of accessory, except the last one, which is the stylopharyngeus. The stylopharyngeus is supplied by glossopharyngeal nerve. The glossopharyngeal nerve is cranial number 9. There are gaps between the constrictors of the pharynx. These gaps between the superior, middle, and inferior constrictors, they contain certain structures we are going to look at now. This is the superior constrictor. Between the superior constrictor and the base of the skull, we have structures here. Look at this blue structure. This is a tube. This is the Eustachian tube. The greenish layer here is a layer which lines the muscles. Between the mucous membrane and the muscles, this layer is called pharyngobasilar fascia. The brownish layer here is a muscle which is called levator palati. So you have three structures above the superior constrictor: pharyngobasilar fascia, Eustachian tube, levator palati. And there is a small artery which comes from the facial artery going up here to go to the soft palate. This is called ascending palatine branch of the facial artery. It's not present here in this diagram. If you look here between the superior and the middle constrictor, you can see a muscle which is number 2 and its nerve number 1. The muscle is called the stylopharyngeus and the nerve is glossopharyngeal nerve, cranial number 9. If you look between the middle and the inferior constrictor, you are going to see this membrane here. This is the thyrohyoid membrane, pierced by two structures, the nerve and vessels. The nerve is the internal laryngeal nerve and the vessels superior laryngeal vessels. If you look downwards, you are going to see below the inferior constrictor nerve and vessels also. The nerve is the recurrent laryngeal nerve and the vessels are the inferior laryngeal vessels. Here is a summary of what we have spoken about now. These are the structures between the constrictors. You can just know two structures in each gap. There are more than two structures, but this is enough for you as an undergraduate student. What are the layers of the pharynx? We know that the pharynx is a muscular tube, so it is formed of muscles. But it is lined inside the most inner layer by mucous membrane. Also between the mucous membrane and the muscles, there is a fascia, which goes upwards to the base of the skull. This is called pharyngeo-basilar fascia. And on the outer layer of the muscle, there is also a fascia which also covers the buccinator. This is called buccopharyngeal fascia. So we have 4 layers: mucous membrane, pharyngeo-basilar, muscles, buccopharyngeal fascia. So the layers from inside outwards: mucous membrane, pharyngeo-basilar fascia, muscles, and the buccopharyngeal fascia. This is a diagram to show you the layers of the pharynx. The innermost layer, the brownish layer here, is the mucous membrane, number 1. Just outside the mucous membrane, there is another layer which is blue in color here. This is called the pharyngeo-basilar fascia. It extends to the base of the skull. Number 3 is this muscular layer. It is formed of circular muscles and longitudinal muscles. The outermost layer is the buccopharyngeal fascia, which covers the muscles of the pharynx and also the buccinator muscle. This diagram also shows lots of important things, like the relations of the pharynx. On both sides you can see this is the carotid sheath, artery, vein, and vagus. And at the back of the pharynx you can find here the vertebrae and the prevertebral muscles, prevertebral fascia, and this space here is called the retropharyngeal space. What is the buccopharyngeal fascia? This is the buccopharyngeal fascia. It covers the muscles of the pharynx and also it covers the buccinator. What is the blood supply of the pharynx? If you want to know any blood supply of any structure, you have to remember the artery which has the same name of the structure you are looking for. For example, the pharynx. Do you remember any pharyngeal branch of any artery? Yes. We have spoken last week about the external carotid artery, and we know that there is a branch which is called ascending pharyngeal from the medial side of the external carotid. This is number 1, ascending pharyngeal branch of the external carotid artery. Also, we have spoken in the infratemporal fossa, and you know the maxillary artery, the third part, gives the pharyngeal branch. And if you look here, this is the pharynx. Any blood supply for the soft palate will give branch to the pharynx. Any blood supply for the dorsum of the tongue will give a blood supply of the pharynx. Any blood supply of the palatine tonsil will give blood supply to the pharynx. So, we are going to think, what is the blood supply for the soft palate? we have taken before that we have ascending palatine branch from the facial, and we have tonsillar branch from the facial for the tonsil. They can supply the pharynx. Also from the maxillary artery there is a branch which called lesser palatine, supplied the soft palate. From the lingual artery, it gives the dorsal lingual to this region. It also supplies the pharynx. So we have to remember branches from the external carotid, from the maxillary, from the facial, from the lingual, 4 big arteries. This is a summary of what we have said now. Ascending pharyngeal branch from the external carotid artery, ascending palatine and tonsillar from the facial artery, lesser palatine and pharyngeal from the maxillary artery, dorsal lingual arteries from the lingual artery. When we speak about the blood supply, we have to mention also not only the arteries but also the veins. The veins of the pharynx forms what is called pharyngeal venous plexus. This surrounds the wall of the pharynx, and at the end they collect in multiple veins that drain in the biggest vein in the neck, which is the internal jugular vein. So remember, when we are going to take the internal jugular vein as a lecture, these are one of the tributaries of the internal jugular vein. What is the nerve supply of the pharynx? We are going to divide the nerve supply into 3 divisions. Motor for the muscles, sensory for the mucous membrane, and secretomotor parasympathetic to the glands. What are these glands? There are some glands in the pharynx under the mucous membrane. They are salivary glands which need nerve supply to stimulate their secretion. So we have motor, sensory, and secretomotor. The motor, we know the motor supply of the muscles. We know that all the muscles are supplied by the cranial part of accessory except the stylopharyngeus muscle, which is supplied by glossopharyngeal nerve. The sensory supply, remember 5, 9, 10. The nasopharynx is supplied by the maxillary nerve, which is a branch from the trigeminal, number 5. The oropharynx is supplied by glossopharyngeal, while the laryngopharynx is supplied by the vagus. What about the secretomotor parasympathetic supply to the pharynx? The secretomotor fibers, they come from a nucleus in the pons, in the brain. The fibers pass through facial nerve, cranial number 7. Then at last it relays in the pterygopalatine ganglion and reaches the pharynx through pharyngeal branch. This is a summary, a small summary to give you an idea. But if you look at this diagram, you are going to see the details of this pathway of the secretomotor fibers. Here is the pons. This is the brain stem, and in the brain stem we have this nucleus. This is the superior salivatory nucleus. This is the facial nerve. So from the nucleus, the fibers pass through the facial nerve. Then there is a branch from the facial nerve, which is the greater superficial petrosal nerve. This nerve in the cranial cavity unites with another nerve, which is sympathetic. So this is parasympathetic and this is sympathetic. This sympathetic comes from the sympathetic plexus around the internal carotid artery. The two nerves unite together to form one nerve. This is called the median nerve, or the nerve of pterygoid canal. It goes to the pterygopalatine fossa to relay in the ganglion there. This is called the pterygopalatine ganglion. And from there, fibers come from the ganglion, the postganglionic fibers, by a branch called pharyngeal branch to supply the glands of the pharynx. So, before the ganglion, these are called the preganglionic fibers, and after the ganglion, this is the postganglionic fibers. The most important is to know which cranial nerve carries these secretomotor fibers. This is the facial nerve, and in which ganglion it relays in the pterygopalatine ganglion. This ganglion is not only for the pharyngeal glands, also the postganglionic fibers go to the lacrimal gland, to the nasal gland, to the palatine glands. We have finished now the nerve supply of the pharynx, and we divided it into three parts: motor, sensory, and secretomotor. The nerves surrounding or coming from the glossopharyngeal, vagus, and sympathetic, they form a plexus of nerves around the middle constrictor. We call it the pharyngeal plexus. Pharyngeal plexus. Pharyngeal plexus is formed of pharyngeal branch of glossopharyngeal, number 9, pharyngeal branch of the vagus, number 10, and branches from the superior cervical sympathetic ganglion. These form a plexus together to supply the pharynx. What are the relations of the pharynx? We have seen that before. On both sides there is the carotid sheath, internal jugular vein, internal carotid artery, vagus, and also the last 4 cranial nerves in the upper part here. Behind the pharynx there is the retropharyngeal space, the vertebral column, prevertebral muscles, and prevertebral fascia. Questions. We have finished now the lecture for the undergraduate students, dental medical students, but I'm going to revise my lecture in the form of questions. What is the action of the constrictors of the pharynx? The constrictors of the pharynx, when they contract, they constrict the pharynx, propelling the food downwards. What is the venous drainage of the pharynx? The pharynx drains at the end into the internal jugular vein. Mention the nerve supply of the following muscles. Stylopharyngeus, palatopharyngeus. We know that the muscles are 6 in number. We have the first 5 nerve supplied by the cranial part of accessory, while the stylopharyngeus is the only one supplied by the glossopharyngeal. So stylopharyngeus by the glossopharyngeal nerve, cranial number 9. The palatopharyngeus is the cranial part of accessory, number 11. Thank you.